With Ramadan being celebrated by the Muslims across the globe, health issue also takes center stage due to consistent fasting. Hornbill TV had an exclusive interview with Dr. Pankaj Patowary from Arbor Vitae Health Initiatives at Guwahati regarding taking care of one's health, especially diabetic patients during the Muslims' holy month.
Please follow me. Today we have Dr. Pankaj Patowary from Arbor Vitae Health Initiative Guwahati with us. So today we are going to discuss about the diabetes patient during Ramadan. Sir, I'm going to ask you a few questions. Like what should be the diet for the diabetes patient during Ramadan?
Yeah. So diabetic patients, especially during the Ramadan fasting, the diet becomes very important. In general, also the diabetic patients, they have a very special kind of diet. It's not that they cannot eat many things; they can eat many things in moderation. So during Ramadan, what we focus is that try to have a diet which contains carbohydrate, fat, protein in moderate amount. Suppose carbohydrate 50%, protein around 20%, fat around 30%. It should be a mixture of everything. It's not only some people what they do, they eat only rice or focus only on say boiled potato or something like that. Those things should not be there. The meal plate should contain a mix of everything: vegetable, salad, roti or rice, and some liquid in the form of say lassi or unsweetened beverages. So if we say like at morning 3:30 a.m. before the sunrise, the Sahari meal or the iftar time. So both the times should contain, the plate should contain fruits, vegetable, some sprouts, rice or chapati, some dal, soup. So it should be the plate should be like colorful. It should contain all the varieties of things, and not only like only biryani or only some one vegetable, not like that. And about the hydration status, the person, they should try to have more water, because diabetic patients, they are very prone for dehydration, because once the sugar rises, the sugar goes out in urine, takes the water along with it. So diabetic patients are prone for dehydration. And in Ramadan, during the summer season, we generally take water, but during the fasting, during the day, they are unable to have liquid water. So especially they should also try to focus on the hydration status. So whenever they eat, they should try to focus that they are taking at least 2 glasses of water or any unsweetened beverages. It may be lassi, it may be in any form, unsweetened beverages. So in the morning at around 3:30 a.m., just before the sunrise, they can have 2 glasses of water. At the iftar, again they can have 2 glasses of water and start it with some 2 or 4 dates. Then at the iftar meal, which is around 6 or 7 p.m., again with the meal they can have 2 glasses of water or any unsweetened beverages. So like this, they should maintain their hydration status, and in the food, they should not focus only on...
Sir, since the fast is during the whole day, how do we monitor the glucose?
Yeah. So in general, for diabetic patients, we ask them to check their glucose like fasting and the PPBS, means before breakfast and 2 hours after breakfast. But during the fast, some people, they don't like to check their sugar during the fast, during the daytime. So what they can do is, just before the sunrise, just before their Sahari meal, they can check their sugar. That will be the fasting. And if they can check 2 hours after the meal, it will be the PPBS, the postprandial sugar. And in the evening, like right iftar, just before the meal, they can check their sugar. That will be fasting, because 8 hours they are taking the fast. And just after the iftar meal, 2 hours after the iftar meal, again they can check their sugar. So that can be the postprandial blood sugar. Generally, we advise to have check sugar at least 6 to 7 times a day, which is ideal. But most of the patients, they won't like to check 6-7 times unless and until it is very emergency. So at least they can check 2 or 3 times a day, like I said, at the iftar, before and after the meal, and at night once. And if there is any suppose hypoglycemia, sugar is too low, less than 70, then immediately they should have some glucose or sugar or some candy. And if it is very severe hypo, very low sugar, then they should try to reach a nearby hospital as early as possible to get the IV dextrose saline. And if the sugars are too high, suppose more than 250, 300, then again they should try to consult their doctor immediately to change the dose of the medicine whichever they are taking.
Sir, what about the medicine timing of the patients?
Yeah, so especially for the diabetic patients, whatever medicine used to give them generally in the morning, before 20 minutes before breakfast, what they should do, they should change their timing from the morning to with the heavy meal of the day, which is at iftar, after iftar prayer at around 6 to 7:30, when they take their meal, the post iftar meal. At that time they can take their usual medicine doses. If they are taking something medicine in the morning, they can take it iftar, and if they are taking some medicine at night, they can what we generally do is we change the timing. The morning time we shift to iftar time, and the night time either we keep it at night or just before the sahari meal. And if they are taking insulin, there should be a slight dose reduction. The morning dose we will shift it at the iftar meal time. Suppose they are taking 20 unit insulin in the morning before breakfast, we will shift it to iftar meal, which they take around 6 or 6:30. Just before the iftar they will take the insulin. And if they are taking insulin at night, we will decrease the dose by 20-30% and shift it before the sahari meal, which is in the morning around 3:30 am. So for this dose adjustment, insulin and tablet, they should at least consult their doctor once, and they should not do it themselves.
And sir, also we would like to know about the myths of the diabetes management.
So some of the myth which generally is there among the people is that regarding the insulin. Suppose the patient is taking medicine but the sugar is not controlled, then we have to start insulin. So the myth, the barrier which comes starting insulin is, they say that once they start insulin, they have to take it for lifelong. The insulin may damage the kidney. The insulin is associated with the needle pricks, which will be very painful. So there is nothing like that. The insulin needle is very small. It's not like the usual needle. If once you can see, it's not that painful, not painful at all. Plus, insulin once started, it's not that you have to take it lifelong. If your sugar is controlled, if the glucotoxicity is controlled, we may shift to medicine. Thirdly, insulin damages kidney. Again, it's a wrong belief. Insulin doesn't damage the kidney. It's the sugar which will damage your kidney, your heart, your nerves, your eyes, and many more complications associated with high sugar, and not the insulin or the medicine. Some even come with the belief that once we start medicine, the medicine will affect our kidney. So again, it's not the medicine or the insulin, it's the sugar, the high sugar, which will affect everything. Second myth, generally the elderly female who are obese or overweight, they have is that we don't eat much and even then our sugars are high. Here the thing lies is their physical activity. They don't do physical activity and they don't eat much also. So this is not the correct way. They should do physical activity in the form of exercise, walking, jogging, yoga, anything they like. Plus eating. Some not eating is also bad and too much eating is also bad. So they should have their diet properly managed. And they say that we don't eat and even then our sugars are high. So here comes the importance of the fat, the body fat, the abdominal fat, and the liver insulin resistance, which causes the sugars to increase. So you have to take the meal, the right quantity, the right amount, according to your BMI, according to your creatinine, sodium, potassium status. Because not eating will make you weak, make you deprived of the vitamins and nutrients. So you should have your diet properly managed, as we discussed. What should be the diet? The fruits, vegetables, salad, which you should include, and should not focus only on one thing like only biryani or only rice or only boiled potato. So that was in short the myths and the diet.
So thank you so much, Dr. Patowary. It was really nice to know that how we should do our diet and follow our diet during Ramadan for the diabetes patient.